Welcome to One Interview, One World. This is Lainey Kay, and this is a show about interviewing people from all walks of life because everyone has a story to share and we can all learn from each other. I hope you enjoy listening.
Our cost effectiveness is going down too. Everyone knows there's a problem. The doctors, the hospitals, the insurance companies, the consumers. We all know there's a problem. Right. We just don't know how to fix it. And I feel like they've missed this piece of it. They're not looking at this whole holistic approach as a way to integrate it into primary care. That's what's missing.
Today, I'm with Theresa Callard-Moore, a holistic psychotherapist and the author of Bridget, the integrative medicine approach to the healthcare crisis in the United States. Theresa created Consumers for Wellness, and their mission is to unite the 59 million people who want to improve their healthcare. Theresa believes that our wellness choices should include nutrition, financial, spiritual, sexual, mental health, and other alternative choices. Most healthcare plans cost $11,000 per year per person, and having more options in our healthcare system would benefit us all. We are going to learn more about Consumers for Wellness, where the consumer can help to change our current healthcare system to a more holistic model with more choices. So thank you, Theresa, for joining me today.
Thank you, Lainey. I'm so happy to be here.
Wonderful. Why don't you give us a little background about yourself, and then we can learn more about Consumers for Wellness.
Sure. I'm happy to share anything. I know you like to learn about people. So I have been in the field of mental health and holistic health, whole health, for at least 30 years. I graduated in 92 with my master's in social work. I've been working with an integrative model in that practice by looking at the whole person, looking at psychotherapy and mental health. We know people are not lacking in Prozac, right? They're lacking in other things. So whether it be love, whether it be nutrition, typically it is nutrition. I look at all those things to try to treat the whole person. That journey, I continued to learn more and more and more. And on that journey, I discovered that I really see a need to take it to the next level, which is our healthcare system itself. And my desire and my goal is to create a holistic healthcare community wellness plan where we all come together and help each other stay healthy and well, as opposed to the sick care plan that we typically have now. So that's where this all sort of started. And I'm happy to dive in at any part of that you want me to.
Mm-hmm. All right. Well, just go in a little more detail as the practitioner. Maybe you could share a little bit about that, what work that involves, and then we can talk more about the Consumer for Wellness.
Sure.
And also what I think would be nice to know about is the different alternative modalities that you would like to see in healthcare choices.
Oh, great. So let's take a typical, I'll pick you and I, right? Middle-aged woman, usually has some children, typically the head of the household, running everything, including everyone's healthcare and nutrition. That's sort of the burden moms typically carry. Not to say anything about dads. I think dads do a great job too, but that's the client that would come in my office. She's going to have fatigue. She's going to have low sexual desire for sure. And I'm a sex therapist too. So that is one of the reasons people come. She's going to have some menstrual issues, something to do with her endocrine system is going to likely be off. She's typically working full time and exhausted. That's the typical client that comes in. So when I'm listening to the story, of course I'm listening for important key things that could be relevant, and I am ruling out for depression and things like that. But even if there is a diagnosis there, my goal is to listen to the rest of the story and try to case manage her too. I can do lots of things in therapy. I do lots of different techniques in therapy. But I also say, you know what? I hear this. Have you tried massage therapy? Have you tried chiropractic? Have you gone to a nutritionist? Do you use organic food? How much water do you drink? How many vegetables do you eat? I'll go into how are we taking care of you so that you could take care of everyone else. Mm-hmm. And that has led me to this model and I'll distinguish the two. My first original model is called the Bridget Incorporated, or BridgetMovement.com. And that is this community wellness program. That is the ultimate goal. I would love to secure the funding so that we could create an insurance plan that covers holistic modalities, including all the things I just mentioned, Reiki, nutrition. I think nutrition should be part of our healthcare plan.
Yeah.
So, I mean, that gets into that. That's Bridget. An offshoot of Bridget. Until this is funded, we've created consumersforwellness.org. That product is a website that's a platform. When someone joins us, it's only $40 a year to join us. We're trying to create an association of those of us who are really looking to integrate holistic and integrative medicine into our lives. We're already paying for it. Those of us who listen to your show, we're already doing it, right? I want to unite us and make a lobbying voice around that. That's the goal of this. So the platform automatically connects you to your legislators federally, but I designed it so that we can do some movement pieces. For example, doctors should be trained in nutrition, right? There's no laws on the books for that right now. I want to send those letters to medical schools. Right? I want to do that. I want to send letters to insurance companies. So we designed it to be comprehensive that way, not just legislators only, but it does automatically do the legislator connection for you. There's another one on there for sexual health, because I believe in sexual health too. As I mentioned, I'm a sex therapist. So I think doctors should also be trained in sexual health. It's another area that most people are not, they're not getting the care that they need. And it's definitely not part of our healthcare plan. So those are the kinds of things that this platform, consumersforwellness.org, is designed to do to help people. We want to empower the consumers. Mm-hmm. We want the consumers to log in there and send a letter, even if you did one a year. Just, do something to let them know what it is you're looking for. Meanwhile, we're gathering that data to see that we're on track for what we're trying to do for that big picture of a community wellness plan.
Mm-hmm. It's beautiful. I love the idea, and I think it's fantastic. So getting the word out is the most important thing.
Yes.
Yeah. Do you work with doctors at all, or, different organizations?
Not specifically. We want to work with everyone. Mm-hmm. I want to make friends and work with every organization. I want to be as inclusive as possible, because it doesn't have to be this way, that way. Mm-hmm. I really feel like you asked the question earlier, what should be included? I think what should be included is what the consumer needs and wants. Mm-hmm. I think we should have a choice about what we want to have covered. You said it beautifully. About $11,000 a year is what our healthcare goes towards, right? Each person gets about that amount each year. I would love to pick where that goes, right? We call it phantom benefits. I have 10 visits a year through my insurance company, and I have a great insurance company, by the way. 10 visits a year to see a chiropractor. I go to the chiropractor every week.
Wow.
Right? Every week, because that's something I need for my body. Mm-hmm. And by the time I get through my deductible, I have a very high deductible, $2,500. I don't mind sharing. $2,500 is my deductible. So by the time I've prepaid for those visits before my deductible's even met. So now I have no visits covered. Right? It's a phantom benefit. They say it's covered, but it's really not covered. I've already paid for it. And then I continue to pay the rest of the year. And they reach out to me and they say, every once in a while they do this quality assurance thing. Was this due to auto accident or injury? No, I do it because it keeps me off of any pain medicine. It keeps me functional. It keeps me picking up my grandkids. Yeah. So that's why I do chiropractic. And you know what? When I was having my kids, I would have picked a whole nother set of things. Right. I would have picked a whole different set of things. As I developed and grew with my family, we would have chosen different things. I would love those choices. And I think that there are lots of people out there. If we just had the basics covered, I mean, if I get in a car accident, absolutely, please cover me. I need care. Okay. Past that, why not pay for organic food and massage therapy and my chiropractic, what the things that I need right now on a day in, day out to help me to help my family stay stable. Right. And I think everyone should choose that for themselves.
Yes. Yeah, it shouldn't be limited to just mainstream. What is it? Allopathic? Is that what they call it?
I think so. Yes, that's the phrase that I've heard as well.
Yeah.
And again, I think those baseline things there are
Yeah.
important measures there, right?
Right.
I just found out I had cancer, and I'm happy to share anything about that you want me to share. So I just had my whole thyroid removed. Now
Mhm.
I'm dependent on medicine. I have to have medicine or I'll die. I mean, I have a stash in my purse. I have a stash in the car. I have a stash in because if I get caught without this, I will perish. So there's a place for this, right?
Right. Of
But
course.
I do think there's a way to, we call it Bridget, and that's
Mhm.
bridging traditional and holistic. That's why we came up with the name. IT is integrative techniques or tips. So I Bridget things too. So of course I take that medicine because I have to, but I take a whole bunch of other stuff too to make sure that I'm getting the right nutrition. And now I have to watch other levels and such because of the cancer. So there's things that we can do to maintain our health as well. And I think that one of the biggest things I'm interested in doing is shifting that need for, we're just going to take a pill and everything's going to be okay, and not take responsibility for what we're eating and how much we're moving our bodies and our mental health and our attitudes. I mean, we really need to shift that. That's, I think, part of the opioid crisis for sure. And we've gotten a bit lazy around that. And I wrote in my book that we want just freedom. We want to just do whatever we want to do. And then when we hit something, it's like, oh, okay, now fix that so I can go back to doing whatever I want to do. We need to take a bit more on and say, wait a second, how am I handling that? What am I doing to take care of myself? For sure, our families, right? And those of us who are moms, we got our kids covered. They're always good. We're not so great about taking care of ourselves, though. We tend to put that on the back burner, like, oh, I can't make it to yoga this week, or oh, I don't have time to eat. I'm just going to do this real quick. And,
Yeah.
I think that's part of our problem too. So a lot of what we're trying to do is bring all that to the awareness front and help to shift those things that lead to our health and wellness.
Yeah. It's interesting that, like you say, the doctors go to school, but they don't get the fact that they have no nutrition training. It seems that it's geared towards a pill to make
Yes.
things better. Being able to see even just naturopathic doctor, like I know my insurance doesn't cover
Absolutely.
it. They're like, no, we don't cover naturopathic doctor. That should be covered, so that would be one main thing. And like you say, the chiropractic, it's sort of covered, but really not. And then I feel like the healthcare system has gotten tremendously worse since Obamacare. I don't know if this is true, but this is my experience. Our insurance costs have gone up a huge amount. Like I think we pay 600 or 700 out of pocket to go with the employer, whatever they're paying. And then we have, I think, a 3,000 deductible per person.
Mm-hmm.
The only positive that I found is I do like the health savings account
Yes.
where I feel like I can then pay for the chiropractor. I guess they're not overseeing that so much. So I feel like you have more freedom than to spend your money. But it's just the money that is being spent and then not utilized with the regular healthcare system is just so lacking.
And you're right. And the costs do keep going up. I mean, last study I had, it's 16.76 per capita. I mean, and our life expectancy is going down. Our life expectancy now is at 60. And we rank, last time I looked, 26th compared to other high income countries. Our cost effectiveness is going down too. Everyone knows there's a problem. The doctors, the hospitals, the insurance companies, the consumers. We all know there's a problem.
Right.
We just don't know how to fix it. And I feel like they've missed this piece of it. They're not looking at this whole holistic approach as a way to integrate it into primary care. That's what's missing. I am encouraged because I see that they're including it in oncology departments. I have found several oncology departments that are using acupuncture for sure for pain management. and they're using massage therapy. They're using other integrative things not only for the persons with cancer, but their caregivers and the staff. We're starting to see that more and more. So I am trying to reach out to those groups and say, hey, we could branch that into your community too. You already have the infrastructure there. Let's grow it from here. That would fit with our model. We're just looking for the right partners to do that.
Mm-hmm. And when people give you a $40 donation or membership fee, what kind of information will they get from Consumers for Wellness?
At that point, it gives them access to the platform in order to write as many letters as they want. And we try to put them on probably 2 per month. Okay. Even so we have several letters already established in there. So it does give them access to that. But I am more interested in the association. Once memberships start coming in, let's meet for Zoom meetings. Let's do town hall meetings. What is it you're looking for? I want to hear people's stories. Like you like to hear the stories. I want to hear their stories. Are we on track? How can we network to grow it in a grassroots way? That's what that's about. Because you and I we can look up our legislators. I mean, it's not that hard to do. You just have to do a little digging and you find who they are and find out their address and write them a letter. Most people don't take the time to do those steps. I know I never did. Yeah. I've never written before now. So I'm just busy doing life, Right. And I think this is a bit of an uphill climb for us because everyone again knows there's a problem, but we're so stuck in it that we don't think we have a choice about doing something different. So we're trying to raise that awareness that, you actually do have some choices here. What can we do differently? I mean, I even asked myself this, and I'll ask you, who decides what is covered on your insurance plan? Is it the employer? Is it the insurance company? Is it the broker? We know it's not your doctor. The doctors don't get to pick that. But I had to kind of dig into this, like who even picks what's on here? How do they decide what to put in here?
Yeah.
And I'm sure there's a lot of research about some basic things like blood pressure and our physicals and such. But after that, how do they decide what's covered and what's not covered? And why aren't they asking us that? I think that should be an essential thing myself.
Yeah. Do you know who makes the decision?
It's somewhere in there. It's between the employer, what they're willing to pay, and get the group rate, right? And then there's a broker in the middle of that. And that's the go-between between the insurance company and the company itself. So somewhere in there is how they dice out, this is going to be covered, that's not going to be covered. And, does that really change by the geography? What we might need.
Right, it probably does.
Is different than what you might need there. So
money motivated is probably the main thing, and not so much thinking about what's good for the consumer. It's probably what's good for the employer and money. It's sad to say that that's probably the motivation behind a lot of it. Yeah, it is a broken system, but it's so nice that you have stepped up to say, we need to change this and let's do something. And I love that it's going to be a way to lobby and a way for you to say, look, this is what these are what consumers are saying. They want these things. So, in the future, it'd be nice. I know you say you want to do Zoom, but to do polls, you can do polls with your people and have that information, and you can take that, with you.
On the Bridget website, the bridgetmovement.com website, we have surveys there for holistic practitioners, consumers, and organizations. So wonderful. You can go there and answer our survey. I would love it if you did. Again, I want to make sure we're on the right track. I've come up with an idea and a business plan, and I've done all the things that I can do, but I want to make sure that I capture what I think people really want. And we will pivot with that as we need to make sure that it stays that way. That's what I think healthcare should be doing, is listening to the consumers and oh, okay, now we need this and now we need that. Let's continue to grow with our consumer. Right.
Yeah. When they sign up and I know you say you can write to your legislature person.
It's federally based. So it will automatically, as soon as you put your address in, it will automatically populate your federal representatives. We just aren't to the level of funding it that we can do your state representatives yet. And, that's just where we are right now. But eventually we'll probably get to the point where we could do your state and local representatives as well.
Yeah.
But we're looking at a big picture, right?
Right.
We want to be able to reach out to the insurance companies too, and the medical schools along with the legislators.
Mm-hmm.
So it's very simple to use.
Have you encountered or worked with any insurance companies to understand where they're coming from?
Not like that, not yet. I have reached out to them to try to, because this program could be a rider to any insurance plan. So we've directly pitched this plan to insurance companies to see if they're interested in incorporating it.
Right.
And we haven't had anyone bite yet, but I'm still willing to do that because I think it's a good idea. And I think eventually someone's going to see that. I'm just still hoping and praying about that.
Yeah. I also feel like as a grassroots, it might be good to have not just reaching out to the legislatures, but having people contact their own health insurance company and saying,
Exactly.
why are you not offering this? Why can't I have this option? Because
Exactly.
I feel like the more that they hear people saying what they want, they listen.
Mm-hmm. Exactly. That's what we're trying to do, is teach people how to advocate for themselves.
Mm-hmm. Yeah. Yeah, that should be a class in college or high school.
Yes,
how to advocate for yourself, because you really, I feel like in this day and age that we are treated as a number, and there's so many of us that they kind of are like, they don't want to seem to like change things, but if you are the squeaky wheel, or they have a lot of people saying, hey, no, then they listen.
Mm-hmm. That's the idea. But again, this is an area that we've all just gotten so accustomed to that people don't think to complain about it. I will say, I'm not going to say it's not better nor worse after Obamacare, because it did change things. But what that did do is make us look at the choices that we have. I mean, it created the conversation nationwide about our healthcare choices. And that alone has spurred on what we're trying to do. Like there are choices beyond what they came up with too. I remember listening to the radio back then. I came up with this right around 2009, and that's when all that was happening. And I would literally yell at my radio, like, "Is this the best you can do? Are you serious?" Like,
yeah.
No. So I just feel like there's more to be created here.
Yeah. Yeah. And I think that's where our world is going, is people becoming more community, involved, and putting their voice out there, and realizing that you do have a voice. You're not a number, and you need to be proactive. And like you say, be an advocate for yourself, but and not just with the healthcare, with everything.
And let me just say, we're saying that so easily. That is not an easy thing. I already said earlier, I did not write letters to my legislators. I didn't even know who my legislators were sometimes. This is not something we think to do. Some people really enjoy politics. I am not one of those people. This is a bit of an uphill climb for me personally to grow. But what I did know is I saw my own experiences, but also my patients, client after client, hour after hour, like, something is happening. We've got to do a better job. Yeah. I mean, just the mental health field alone could use a tremendous overhaul, but it is part of the healthcare. And I just saw all these problems. And if we didn't fix those, basically it came down to, I wanted my client to feel better and to be better. And what I could do for them wasn't enough. That whole system needs to change in order for them to be better. Yeah. So I would teach them to advocate to their like, oh, you know what? If that doctor didn't help you, let's go to the next doctor. Let's go to the next doctor. Let's do this. Let's try this. And when they came in and said, I've been to so many doctors, I've tried so many things, I'm like, okay, now we're ready for the holistic side. And then I would take them through all the case management of, let's try this. Let's try this. We're going to keep trying until we figure this out. So that's the attitude that I've adopted for this company. I'm just going to keep trying until we figure it out.
Beautiful. Yeah. Yeah. And I agree with you. I mean, a lot of people don't feel comfortable, doing letters, but you're doing the legwork that helps them be the voice, because then you have the information, and then they can just easily write the letter. Yeah.
We try to make it as so easy as possible. And there is a section, we pre-write the content of the letter, but we leave a section for them to put in their story, their concerns. You can edit the letter too. That was important, right? Because everyone has their own, I want people to say, I want this, right? But we also wanted to learn what it is they were looking for. So we're learning at the same time they're sending that off.
Mm-hmm. In your practice, do you work with health insurance, or is it more like they're paying outside the system?
I do both. I work with the insurance company as a contracted employee, as a contracted person. Mm-hmm. So I certainly know the ins and outs of how that works and what that's like for people. And it's very inconsistent.
Right.
I mean, it's very confusing. Most people don't understand the difference between a deductible and a copay and how much it all costs. We started to talk about that earlier. And in my book that you mentioned, Bridget, I talk about healthcare math. And once we look at, let's say I'm an employer and I'm hiring you, and I'll say, you know what, I'm going to pay you $85,000 a year or something. Let's just pick that. By the time we deduct your healthcare costs, right? And the other things that they take out, I mean, there's taxes and such too. But by the time they deduct that healthcare cost and with the part that you pay, you're really only making what, 60, maybe 55,
Right. Right.
Once they take out all those costs. And we in America, and I'm going to compare the two. In America, we think, oh, I make 85. No, you don't. You really don't. So then we budget ourselves, the car, the houses, the food, the furniture, whatever, our leisure time on that number. Well, we actually don't bring in that number, right? And our healthcare costs, these deductibles and copays, they accumulate, So we get into an unhealthy place financially too. And that's why I said, I think this is an important part to look at the whole picture, the whole person. How are we looking at how financially healthy you are too, looking at the real math? And I said it, I compared it because I've had exchange students. And when I talk to them about their incomes and their careers and such, I'll say, is that before taxes or after taxes? Because they have a national healthcare plan. And, 50%, we've all heard the stories, right? They take half your check. And that's what she said. She goes, we don't even count that other half. So when someone asked her, how much money do you make? She would automatically say 55 if she was really making that 85 or 90 or whatever it is. Mm-hmm. She just thinks, I only make this much. Right. And that to me sounds healthier because at least you know where you're actually at, right? And you can make better choices about the other things we need to spend money on. Right. I mean, there's school and cars and all this gas. I mean, all these things and what comes up if we're short of money, you just think about it. If we're short of money, what do we cut corners on?
Always your health, huh?
Yeah. Food. Okay. We skimp out on our food. We get cheap, bad food for us. Right. Yeah. I mean, that's the one thing we can cut. If you can't cut gas, we're going to cut that one thing that can fluctuate, right? Because our car payments and house payments are always the same, but our food isn't. And there's days we can spend more and there's days we can spend less. And when we're short, we usually spend less money on food. And if you think about it, most people, their diets come from a convenience store food base group. Whatever you walk into a convenience store, what's on the shelves, that's what most people are eating. And that is not the good stuff, right? That's not the fresh stuff. And it's definitely not the organic stuff. Right. So that just leads us down all these other chronic illnesses that we see, right? Diabetes, heart disease, etc. Mm-hmm.
Yeah, it's amazing. Tell us a little bit more about the Bridget book.
Sure. The Bridget book is my story. This started in 2009. And I was at a conference learning because I love to learn. So I was at a conference and it was on sexual health. And I asked questions like, do you use inositol for obsessive compulsive disorder, which is a B vitamin, by the way? And they're like, no, we don't do that. I'm like, oh, okay. And then later I said, do you do energy work? Because I'm a Reiki master. So I'm like, do you do energy work on your patients who are inpatient and things like that? For stress and anxiety? No, we don't do that. And I thought, oh, okay, I'm not with my people. I need to not, because there's a point where people are like, is this a little too woo-woo, right? We have to kind of be careful who we're talking to. And the presenter came up to me and said, "What are you doing? Where's your research? Do a presentation, get your PhD, bring it, bring it. What do you got here?"
Right.
And that was the start of it. And I was driving through the mountains in Arizona, and I had this epiphany about a wellness plan. And it just brought in all the things I had been doing in my practice, but on a macro level. I just sort of flipped it in my mind. And I went to this restaurant. It happened to have those paper tablecloths, which was great. I literally cleared the plates and drew this thing that was in my mind. And I thought, oh my gosh, that could work, right? Now I got to tell people about this. That was it. That was the start of it. That was in 2009. So I tell the story about, applying for the patent, trying to get funded, trying to fund it myself, and raising money with friends and family. At first we tried to grow it because I had to raise money, as a directory, a holistic directory. And reached out to the local communities. We did community events like children's holistic health fairs. We did provider panels on different topics. Like one was diabetes, one was cancer. And so the different providers would talk about, here's what we could do for that, right? How we could help the community. So we did a lot of events, and those went really well, but the directory didn't. Most providers didn't need another directory. And it didn't help us with advertising costs. We were trying to get an income cash flow going so that we could do the next step, which was the discount membership program. So it's the story of and all the consumers. We were gathering data and research. So it's all the surveys that they did and all the case management things that I did. It's just the story of what we've tried so far. Again, I'm trying to reach the community and tell our story so that we can get people involved to say, hey, do you want to do this with us? And so that's the story of that book. We had to close the company in 2016. We went from 12 to 16. And then I bundled it up as a seed idea, still looking for funders. And now we rebranded it to the Bridget movement. And off that, now we've developed Consumers for Wellness. So that's the short story. The point is, I'm still going to keep going. If we stall out here, I'm still going to have a seed idea, and I'm still reaching out to people saying, hey, this is an idea. Do you want to do this with me? I want to partner with you.
Right. Yeah. And did you work with associations, like, say, I don't know, does Reiki have an association or chiropractic associations or things like that?
We went to the Chiropractic Association. We reached out to the Massage Therapy Associations. There's lots of holistic organizations. We've reached out to all of them. For sure, the Chamber of Commerce, Holistic Chamber of Commerce. Excuse me, Camille and I have been brainstorming this whole time on how we could work together. So, and that is part of our business plan, to work with the Holistic Chamber of Commerce as we grow. So yes, I've been reaching out to anyone who will listen.
Right. Yeah. And then the medical boards, how do you reach out to them? Or is that something where you're asking the consumers to also write to them?
No. What happens is, if you do a letter and it's one of those that would apply to the medical schools, then that copy of that letter comes directly to me as one of the recipients. So it'll go out to your legislators, and it'll pop over to me too. And then I'm collecting those letters, and I'm going to send them to the medical schools. If we had to make sure we weren't setting up so it would look like spam, and then it would just go into a junk file. So I'm going to make sure it's a cumulative voice and reach out to them directly as we get people participating.
Yeah, really good point. What about calling the legislatures? Is that beneficial as well?
Absolutely. I know there's some sort of calculation, one letter equals 1,000 people, right? That thinks this way too, that there's just that one person wrote a letter to say it. But if you called, or they certainly participate in Twitter and Facebook too sometimes. So, but if you called, I feel like it's 1 in 10,000 people. It seems like it counts more when you call. And we have a multimedia event. The way we set it up is multimedia. So it'll hit Twitter, it'll hit Facebook, they'll get a letter. It comes in different ways.
Good. That's really good.
At the end, there's also a way that you could send that same letter, your letter, to your local newspapers and media. So it can be a press release type thing.
I like that.
Either letter to the editor is what I wanted to say. It could be a letter to the editor at the end.
That's fantastic. I love that you really have the details down, ways for this to really work. Yeah.
Yeah, we try to make it as easy as possible because people don't take the time to do it. I mean, we could, like I said, you can figure it out. It's not hard to figure out, but we want to just set it up. So our key issue is the integrative medicine, that we're looking to integrate medicine
Right.
and holistic health. And then these other letters are a health savings account is one of those on there because there are bills that support that. The oncology, the cancer oncology, the holistic approach to oncology is on there. One of them is the daylight savings time because
Oh,
it disrupts our sleep so much. And they've been talking about, taking it away. I think they should. Personally, I think they should. And because it disrupts us. I mean, if you've ever felt that way, it takes me a week or two to just kind of feel like I'm back regulated, and little kids. So our sleep, we need it in order to stay healthy and well. So there's different topics on there.
yeah.
And again, I mentioned we're adding more every day. So, people can just check back in, and we send emails to our members and say, okay, hey, this is the current topic. Do you want to pop in and send a letter on this one to get people continuously engaged?
That's beautiful.
Yeah. Thank you for letting me share my story about it. I appreciate that because I think people think this way, but
Yes.
they don't take that next step. Right. And
No.
that's part of the issue that we're trying to overcome.
I feel like a lot of people are apathetic. They just don't care anymore. And they're so busy that that's
busy.
just not a priority, but it should be a priority. When you have people that are in a legislature that are supposed to be working for us, but they really are not listening to us. That's what we need to do. We need to get our voices heard.
I looked up a couple of research articles on this topic. The first one, it was more about women are more likely to advocate for someone else besides themselves. Women do not advocate because they want to be liked. They are great advocating for other people, and they're expected to do that for other people. Like we just assume they're going to do that. Women feel uncomfortable, uninterested, unmotivated in tasks that require self-advocacy and don't perform as well as a result. And then when I looked at top reasons why people don't advocate for themselves, this is what we came up with. 5 is contentment. Lack of participation could indicate satisfaction with the status quo. If it personally affects them, they will consider participating, but otherwise it just goes on a back burner. They're just content. 4 is apathetic, and I think you mentioned that people are ambivalent about the government affairs, advocacy issues, or choosing to do anything about it. 3, they feel alienated. People do not participate because they feel no one in power listens to their views and the government is indifferent to them. So they feel like they don't care. 2 is lack of knowledge. They feel like their skills are lacking and that they're not knowledgeable enough to talk to someone in power, right? So we want to work on that for sure. And the number 1 is fear. People fear they will not know as much of their issue as their elected official and that they won't be able to meet with them or be heard by them. So all of those things are what we're trying to correct on our social media as we're reaching out to people, is how do we overcome all of those levels right there? Mm-hmm.
Yeah, it's a lot, but I'm really glad that you stepped up to the plate, and I think it's a beautiful plan, and I really hope that people will jump on board because we need to do these things. And I 100% agree in regards to our healthcare, but I think in regards to anything that we're not happy with, we need to be a voice. So
I agree with that.
Yeah.
Mm-hmm.
And yeah, I feel like we have so many people that are thinking the same way, but we're not being treated the way that we're thinking, I guess. We want it to be more community minded, like you say, more holistic, more options, and not who wants to be told what you can and can't do. There should be so many options to choose from.
Yes, I agree with you. It's your money, your health, and your choice. I feel like we should make those decisions in each stage. As I mentioned, I would choose it differently 20 years ago. Now that I'm older and I have a cancer diagnosis, there's things I want to incorporate in here.
Yeah. Mm-hmm. Oh, wonderful. All right. Well, why don't you tell people how to reach you?
Okay, great. You can reach me at consumersforwellness.org, and that's 4, the number 4 instead of FOR. So consumers, number 4, wellness.org. Also Bridget, BRIDGEIT. So it's bridgeitmovement.com. All of my information is on there. You can reach out to me directly. I would love to hear your stories. I would love to hear what you'd like to see. Those surveys are on those websites as well. So you can always, tick into that on Bridget and answer the surveys and tell us what you're looking for too. And Consumers for Wellness, for only $40 a year. I mean, if NRA can have a lobby, right, and AARP can have a lobby, wellness can have a lobby, and that's what we're trying to do. So it's only $40 a year. We're not trying to break a bank.
Absolutely,
we just want to create an association. So that's it. So join us on Consumers for Wellness, and join our movement, and hopefully we can shift healthcare, just one step at a time.
That's beautiful. I also like to ask people a question at the end, and it's, what do you feel humanity needs to work on to make our world a better place?
Humanity needs to work on, I was going to say compassion, and that's probably the answer. It's so easy to define ourselves as, I am not like you, or I am like you, one of the two, right? That's how we define ourselves. And if we're looking for compassion, we're really looking into that person's heart and soul and saying, how are we like one? That's really what that's about. So that's what I practice in my office. That's what I practice in my personal life. And that's what I think humanity could work on.
Thank you, Theresa.
Thank you, Lanny. I really appreciate you talking with me today.
You're welcome.